Bonnie Crombie, leader, Ontario Liberal Party. Bonnie Crombie is the newly elected leader of the Ontario Liberal Party. She previously served as Mayor of Mississauga from December 2014 to January 2024. Bonnie was previously the MP for Mississauga Streetsville from 2008 to 2011. From 2011 to 2014, she was a Mississauga City Councillor representing Ward 5. Bonnie attended St. Michael's College at the University of Toronto, earning an Honours Bachelor of Arts in Political Science and International Relations. She has an MBA from York University Schulich College of Business and earned a Corporate Director's Certificate from the Institute of Corporate Directors at the Rotman School of Management. MPP Adil Shamji, Health Critic, Ontario Liberal Party. Dr. Adil Shamji is the MPP for Don Valley East and the Ontario Liberal Caucus Critic for Health, Northern Development, Indigenous Affairs, and Colleges and Universities. Adil attended the University of Western Ontario and completed medical school at the University of Toronto. After having spent his earlier years providing healthcare on Indigenous reserves across Canada, Adil most recently served as an emergency physician and the medical director for 11 homeless shelters in the City of Toronto. In addition to his role as physician, Dr. Shamji worked as a faculty member in the School of Medicine at the University of Toronto. So we'll first welcome Bonnie.
I'm sure you've heard this joke all day, but there's something very Harry Potter about this room, right? No kidding. Actually, my son went to university here, so I'm very pleased. Quite a place. Wow. So good afternoon, and a very huge thank you to both Doris and Claudette for inviting me here to speak with you and our team. As the new leader of the Ontario Liberal Party, it's so important to me to be joining you, RNAO, early on in my tenure to set up our relationship for success. There's so much good that I believe that we can do working together, and goodness knows there's a lot of work to do. I don't need to tell our nurses this because you already know it too well and unfortunately firsthand, but there is a crisis in our healthcare system. We see firsthand how nurses are treated without the dignity and without the respect that you deserve. Amongst Canadian provinces and territories, Ontario has by far the lowest registered nurses per capita and continues to fall further behind the rest of Canada. Ontario would require 25,000 more RNs just to catch up with the rest of the country. Those two facts alone are a terrible indictment of what is occurring under this government's watch. And what's worse is that it's deliberate, a result of intentional choices by Doug Ford and the Conservatives. Ford and the Conservatives withheld needed funding for our hospitals. The Conservatives are deliberately privatizing our healthcare to benefit their rich friends and insiders. They don't share our values of a strong, universal public healthcare system. The Conservatives fought our healthcare heroes to deny you fair wages every step of the way, and that was frankly shameful. And what are the results? There are about 2.3 million Ontarians without a regular source of primary care. Wait times in ERs are skyrocketing. Hallway healthcare is worsening, with over 1,300 people on average receiving hospital care on stretchers in unconventional spaces every single day. The Conservatives are failing to care for our seniors, the most vulnerable, and every Ontario family who relies on our cherished public healthcare system. And that's why we are going to defeat this government and replace them in 2026. But more than beating Doug Ford, I believe we deserve better. I want to lead a government that cares, that works every single day to ensure every single Ontarian and every single family can live a better life. And that's the very purpose of public service, to make life better for ordinary men and women and their families who call our great province their home. Doug Ford has different priorities. He serves his wealthy, private interests, and we see that so clearly in our healthcare system. Ford is not bumbling from crisis to crisis, make no mistake. Rather, he's making deliberate choices to starve our public service of the funding it needs, and then suggesting more private, for-profit medicine is needed to fix the very problems he has created. The sheer audacity of this scheme is appalling. This deliberate neglect to fulfill a conservative ideological agenda is exactly what we are all up against. And it's going to take all of us working together to bring in a new government, one that cares. And I need your help as we build the team and plan on who's going to run in 2026 to ensure that we have the strongest, most progressive offering to improve our healthcare system. You never know, there may be people in this very room who may look forward to running in 2026. There is no healthcare system without our registered nurses. And I commit to listening to you, as I did when I met with Doris and Claudette, hearing your concerns, but also hearing your ideas because, of course, you are on the front lines. And I also have a few simple pledges to share with you today, since it's still early in my tenure as leader. We need to raise nurses' wages to be competitive. That's right. Yeah. And we need to address these for-profit temporary nursing agencies. I want the public system to be the system that you know that has your back, that pays you a fair wage, because you always have our backs. What happened with Bill 124 was utterly unacceptable. The Premier and his government spent all of the pandemic telling you that you are healthcare heroes, and you are, but yet they fought you in court every step of the way, and it was demoralizing, it was unfair, and ultimately it was ruled unconstitutional too. Frankly, it's shameful for the Premier. He couldn't even bring himself to apologize for taking you to court and suppressing your wages, keeping them down. Because let's be clear about this. Nurses are the ones that are there for us. We need you. And we need a government that is there for you in return. I will expedite accreditation of our internationally trained nurses while creating new spaces in existing nursing programs and establishing new nursing schools. That's why we need you, because we need you to guide us. The government I lead will ensure the province supports programs that incentivize nurses to stay and to serve those small and rural and remote communities, such as by offering nursing students free tuition in exchange for serving in underserviced communities upon graduation. And while we're on it, let's see about a program to bring recently retired nurses back into service to help mentor younger nurses. That's right. It's a no-brainer, right? Some of them retired early because of the pandemic. We need them back. We need all of you. We have to boost the number of nurse practitioners-led clinics and ensure that OHIP coverage for their services is available so that patients do not have to pay out of pocket, right? We need to compassionately tackle the opioid crisis that's ravaging our cities, ravaging our small towns too. Every family has a story or a connection to tell about addiction. We all have or had someone we loved who suffered from mental illness. We need to treat addiction first and foremost as matters of health care, to care for people, to keep them safe and to support them on their path to recovery. We need to invest in pharmacare, and I'm so delighted at this federal announcement, and build upon the work that's being done today by previous provincial governments so that everyone can afford their medications and no one is rationing pills or choosing between a prescription or gas or groceries for their families. These are the core areas I believe we need to improve, and I am committed to acting on your ideas. In recent years, nurses have been there caring for me, for my family, for my son recently when he broke his arm. He was crazy. He was, what do you call that game? Arm wrestling. And bone popped out of his arm. Thank goodness for the RNs that were at his side. And my 88-year-old mother, who seems to always require attention and care, especially when she had hip replacement surgery a year or so ago. I'm living in that sandwich generation, maybe many of you are as well, with young adult kids and a mother who needs a lot of support to continue to age in her home. So I appreciate firsthand not only the value of our nurses, but also how you need a supportive environment, a strong team, with PSWs paid fair wages too, and enough doctors to meet the needs, and also innovative systems and health teams so registered nurses, nurse practitioners, pharmacists, and social workers can all care for us together. Primary care teams, that's what's needed. Indeed, we need more registered nurses, and that is the bottom line. Before I was mayor, I was closely involved with my hospital network. I served as a fundraiser to ensure that the community was raising the much-needed funds that weren't available from the government. As mayor, I worked closely with our hospitals to ensure that we're rebuilding Trillium Health Partners. And I work closely with our medical officer of health in public health. But I also recognize that I have more to learn from you, and I welcome your advice. As leader, and I hope one day as premier, I will work with our caucus, including our health critic, who you're going to hear from next, Dr. Adil Shamji, and all of you, to ensure that we deliver for you so that you better can deliver for all of us. And together, we will defeat this government and lead in a new direction for our healthcare system, one based on fairness for nurses and for providing you the resources you need to care for all of us. So I'm honestly very grateful that you invited me here today. I want to thank Doris and Claudette, and I look forward to the conversations and the work ahead. And I hope you will continue to share with me your ideas with me and members of my team. Thank you very much for having me today.